Hello, today we will be presenting on the assessment of skin color diversity in dermatology medical education resources. My name is Sophia Arbuiso.
My name is Gorgy.
My name is Sonali Shah.
And we are all second-year medical students at New York Medical College. To start with some background, there is a lack of diversity in the depictions of dermatological conditions in educational resources, and this paucity can lead to misdiagnosis in patients with skin of color. Typically, medical research divides skin tones into a binary system, just classifying them as either skin of color versus non-skin of color, which does not inclusively represent all skin types. The three of us worked with the dermatologist to review dermatology images from USMLE First Aid for Step 1, the 2020 and 2021 editions, USMLE First Aid for Step 2, the 10th edition, Pathoma 2021, using the Fitzpatrick classification scale. The Fitzpatrick classification scale is a numerical scale that classifies skin color ranging from type 1, which is the palest, to type 6, which is the darkest. Fitzpatrick classifications from the textbook Dermatology by Jean L. Bologna et al. Were obtained from the study conducted by Riley Luther et al. 153 patient images from medical education resources were collected and evaluated alongside 3,583 images from the textbook Dermatology. We sought to identify the representation of different skin types in medical education resources based on the Fitzpatrick classification scale.
We found that the majority of images across all resources were classified as Fitzpatrick type 2, accounting for 54% of images, followed by Fitzpatrick type 3, accounting for 27% of images. And you can find the reference of the Fitzpatrick scale at the bottom of the slide. The least represented skin type included Fitzpatrick types 5 and 6, each accounting for only 3% of all images. Fitzpatrick type 1 also represented a minority of images, averaging 8% across all evaluated images. The percentage of Fitzpatrick types 4, 5, and 6 were similar between the general resources and dermatology textbook, both averaging 10% and 12% respectively across all images evaluated. This is the table of our findings, and you can see the resources that we used, including First Aid Step 1, First Aid Step 2, Pathoma, and Bologna. The last column represents the average of all the Fitzpatrick classifications. As you can see, the most represented skin types were type 2 and 3, and the least represented were types 5 and 6.
We also evaluated graphics appearing in USMLE First Aid for Step 1 in both the 2020 and the 2021 versions. Graphics appearing in the 2021 version were updated compared to the 2020 version, with about 68% of graphics in the dermatology section resembling skin types, Fitzpatrick types 4, 5, and 6. And this was in comparison to 0% of graphics resembling these skin types in the 2020 version. While graphics were updated, patient images in USMLE First Aid 2021 edition were mostly unchanged from the 2020 version, with the exception of one additional Fitzpatrick type 5 image in the new edition. Here is the distribution of the dermatology graphics we evaluated in USMLE First Aid for 2020 and 2021. As you can see in the First Aid 2020 edition, almost all images were types 2 and 3, while in the 2021 version, the graphics were diversified to include more of the Fitzpatrick skin types. In conclusion, our findings demonstrate that the lack of skin diversity continues across many medical school resources and dermatology-specific resources, with fair skin accounting for the majority of all medical images. Although First Aid announced an update to be more inclusive of all skin types, patient images continue to have low representation of darker skin, while only graphics were reflected to have darker skin tones. In conclusion, there needs to be increased diversity in patient photographs depicting the presentation of skin diseases to combat the gaps in medical education and healthcare. Thank you.